minute or two, because it looks not quite as full as it did this morning, so I'm not going to take it personally. Should we get going? Good afternoon, everyone. Turn the volume up. We were debating whether we actually needed mics because the sound in this room is so extraordinary. So I'm Jo Blundell from the Government Outcomes Lab, advisor to the Government Outcomes Lab, and some of you will be relieved, hopefully not many of you will be disappointed. We're actually not going to talk about SIBS in this session. We're going to have a little break. And we're going to talk about something which is very much still around outcomes, as I guess you'd hope with being Government Outcomes Lab, but around what we're seeing as a different approach to achieving outcomes, a different way of public services working together, both and with the voluntary sector in particular, and their citizens, and in some cases with businesses, to collaborate, to work relationally in a different way to achieve outcomes. And we're seeing what we've done in some work, which hopefully you've all read cover to cover, which we won't hold you to because Claire's going to give you a little brief on the work that we did, called Rallying Together. And that was our attempt to look at this emerging practice and to look at how it's taking form, what shape it's taking, and what challenges it's bringing. So this session is about exploring that with this august panel, which I'll introduce in a moment. So what we're going to do today is have a fairly informal session, in the sense that we're going to have a brief presentation from Clare, a whistle-stop tour, which probably leave lots of questions about what we found. So please chip in and ask more questions about the work as we go through, if you want more of the detail. And colleagues who also did the work with us are in the room as well, if Clare and I have a senior moment, probably just my case. But so we will invite you to ask questions throughout. So we're going to take it sort of topic by topic in the discussion, and then give room for you to chip in questions rather than leave it to the end. So I'll introduce the panel first. I'm going to introduce, I think the people have been asked to introduce themselves in other sessions, but Adam Lent is CEO of the New Local Government Network, going to talk particularly around some fascinating work, which I would commend to be on your reading list if you find yourself interested in this work, called The Community Paradigm, which is around really how citizens are getting involved more as members of the community. So with that, an area that we've explored a little in our work, and Adam and colleagues are exploring much more deeply in the work, so we really welcome Adam here to talk a bit more about that. Gary Wallace is part of the public health team, a public health specialist in Plymouth, and has done some quite amazing work in Plymouth around really moving away from traditional contracting to engage lots of actors in Plymouth to achieve better outcomes for the most complex of individuals. And so we'll talk to us today a little more about how they've done that and how it's different from the way that you might expect or see in other forms of the way we achieve outcomes. Rob Pollock is a fellow, Gary, sorry, should have mentioned that, Formerly a senior civil servant in Treasury and now part of the social finance team, so poacher and gamekeeper in lots of ways, and interested in different ways, and just helped us contribute a little bit to this report as part of the evidence that we took. And Rob Macmillan is a Principal Research Fellow at Sheffield Hallam and has a particular expertise in third sector and voluntary sector, and will hopefully shed some insight into what's different about the way that we're engaging the third sector and voluntary sector as part of collaborative relationships, as opposed to perhaps more traditional ways in which the public sector has worked with the voluntary sector. And finally, and certainly not least, my colleague Clare FitzGerald, who's a research fellow here at Blavatnik and the Go Lab, who is a co-author of the Wrangling Together work, and he's going to do the presentation now and tell you a bit about what we found. So Clare.
Sure. So hopefully you've picked up a copy of the report. It's called Rallying Together, Collaboration in Public Sector Reform. And so I think it's helpful maybe to talk through why we decided to do this piece of work. We noticed a couple of different things, right? That there's this mood change happening sort of in central and local government units around hierarchical forms of contracting and performance management. Perhaps these tools weren't working the way that they were supposed to or anticipated. We saw some new signals coming from central government and sort of the role of civil society and how that would become activated or core to what's happening in local communities. And then we also observed that local areas themselves were striving for better outcomes, but they were not using the sorts of tools that we had been looking at. So those are sort of social impact bonds, payment by results. So if they're not necessarily leaning to these more traditional contractual arrangements to guide collaborative practice, like what are they doing and how can we describe it? So we decided the best way to begin to describe it was to talk to folks. And so what we did was try to find areas that sort of fit 4 criteria, right? One was that there was direct local government involvement in whatever the collaborative practice looked like, that there was a local government service responsibility, so we wanted the collaboration to be contributing to core functions of local government, that there was a focus on outcomes in these areas, and that the relationships were beyond just contractual ones, that what we saw was that there was an exchange of ideas as sort of humans mutually motivated by improving conditions in the area that they were operating. So what we did was talk to 10 locally led projects, and I want to at least say their names because they obviously contributed to this, and this is a report about collaboration. So we spoke with Doing the Right Thing, which was led by Somerset Richmond Group, Golden Key, Ignite, Kibble Home Paisley, Oldham Council and their work on the Oldham Plan, Plymouth Council and a particular piece of work around an alliance contract, which Gary was involved in, the West London Zone, Wigan Council and the Wigan Deal, Wirral Council and the Wirral Plan, and Young People's Foundations. And so what we did was host some learning calls. So we gave them a call and asked them a bunch of questions around what's going on and how are you thinking about these kinds of things. And we followed that up with 3 particular projects for further detail on what was going on. And so I think it's helpful to point out that a lot of these were maybe sort of more recently constituted. So we see them coming together maybe from about 2013 to 2019, that they all look different, right? They're approaching collaboration in different ways, and that's probably an important thing to realize. That the scope varied. For some, this collaboration was wholesale and quite wide-ranging in terms of what the local authority was doing. And for some, it was very targeted on specific services and changing practice at the front line. And then the other thing to note was no one described themselves as done, right? They're all works in progress. And so, we found out a couple things, and that's what I'm here to talk to you about. So first, one of our questions was, why are you collaborating? Why are you trying this? And I suppose in a helpful conversation I had with Nigel, what we talked through were perhaps some exogenous or external factors which led people to collaborate. And those were sort of around austerity and local budget cuts, a sense of rising demand for services, citizens wanting more of a say in the services that they were provided, and also a sort of maybe growing distrust or disengagement in political party narratives and the institutions that are supposed to be serving marginalized people. And so it was less that people were opting into collaboration, but perhaps more so that they were being led to trying to do something different, and collaboration felt like a reasonable response to some of these. But with those drivers, people articulated maybe reasons or hypotheses or perceived benefits to doing something collaborative. And those were articulated by projects as wanting to share financial and maybe service delivery responsibility. They wanted the voluntary sector to maybe take on a more significant role in social challenges. They thought it would deliver better impact and value, and that it would fundamentally make the public sector a better place to work. That by collaborating with other organizations, they could in fact improve their own in the event that they were government. So what did they look like? What structures did they take? We came up with sort of a typology around this, right? We saw collaborative councils, which were these wholesale sort of big changes that different areas were undergoing, involving kind of everyone that was interested in changing public service delivery and engagement with citizens. We saw collaborative markets, perhaps where councils were taking a sort of tack at trying to change maybe some of the more competitive tendencies between organizations and bring them together to pursue outcomes that they were mutually responsible for, but perhaps were not necessarily able to deliver well aligned. We saw agents of change, which perhaps smaller organizations trying to shift frontline services to function differently. So again, external agents coming in to change bits of the system. And we also saw system connectors. These are, in academic speak, more sort of like network administrative organizations, right? So external bodies that come in not to change the sort of actual infrastructure itself, but to change the way that that infrastructure is joined up, right? To help them think through what their assets are and perhaps rethink the streams of financing and information and referrals and all of these operational realities. Can they take on some of that administrative burden? We also asked how collaborative working was ingrained, right? So what were the things that got people to sort of behave collaboratively? And we sort of focused on 4 things. Leadership, which perhaps was characterized by sort of a move from hierarchical to facilitative approaches, in particular thinking about management or leadership being responsible for learning and facilitating those kinds of learning-oriented conversations. We saw a shift in culture where it was characterized by a commitment to aims and visions and purposes of the collaboration, perhaps more so than the organizations that constituted it. We saw infrastructure shifting, right? So this was around shared data, shared spaces, and changing the way that organizations physically operated. And then also community as sort of partners in service delivery. So for the sake of speed, what I'm going to do is focus on 2 things. First, we'll talk through some of the culture findings and then the community findings. So that arrow lets you know we're now talking about culture. So what did we see? Well, this whole idea that the collaboration was about forging a new identity, that people were taking off their badge and becoming members of a collaborative entity. There was a push that they needed to avoid new bureaucracy. So we need to trust people at all levels to sort of interpret what our shared intent is and work to that intent. But in particular, it was important to look after those middle manager folks, right? The people whose power was sort of concentrated in being able to have administrative rules to guide and lead operative working. But instead, we need to sort of shepherd them into a process that they become sort of facilitators of team learning. There was a shift in empowerment and accountability, so giving permission, not only the sort of bandwidth, but also the permission to think differently about the services that they were delivering, and creating a climate wherein failure isn't necessarily about blaming someone, but it's about sort of learning and holding people to more personal accountability. And then also this idea of collective and individual interests, right? That the focus on collective action rather than organizational interests. And the quote that we heard was that you have to start working on the outcomes through the system rather than just through your organization. Finally, community, right? And this is perhaps an area where things are relatively contentious, which is what is the appropriate and right role of the community in public service provision? How could we ensure that people engage in a meaningful way that is not overly onerous or sort of misguided in terms of their capacity to engage? And so a lot of this was around building community capacity, and so wanting local organizations to be strengthened and local leaders to be sort of identified and grown up. To empower citizens to self-help and organize. In some ways, this looked like actual asset transfers, so moving things that the state would have operated into the hands of community organizations. Some of this was around asset-based learning, right? So, or working, excuse me. So really understanding that the state is not capable of working everything out for everyone. So how do we change citizens' sort of appreciations for their own aspirations and think about how they might redo their sort of family plans? A reciprocity of obligations, the councils and government saying, we'll do our part if you do your part. So this idea of civic duty being a bit more concretely articulated to citizens. And also this notion of positive inquiry and human connection, that you want to enable your sort of street-level bureaucrats, your frontline teams, to have honest conversations with the people that they are serving, and that is a human connection that needs to sort of characterize that rather than an administrative or a managerial one. And so those conversations felt very different, and you should allow them, was kind of what folks were saying. So the last question was, what does success look like, right? So this was a question perhaps around measurement and accountability, and in particular it was really about how collaborations define success and track progress towards goals. It's probably unsurprising, especially for those of you who are in the measurement session during the last parallels, that this was, there was a wide range of sort of views on this topic. And so what we heard was that sort of folks felt that using targets on agreed indicators was outmoded, overly reductive, paints an incomplete picture, that targets were running completely counter to the ethos of collaborative working, and others saying that measures are important for learning. They have limitations, but they can be useful. And so sort of, as you might expect, the sort of most frequently articulated challenges were the issues of multiple partners, of complex social problems that were hard to quantify and attribution was very difficult, cultural norms, that the organizations in these collaborations had very different appreciations for what the information should look like and what information was reasonable to make a decision upon. And also time spans, that the sort of highly robust information that might sort of show up very, very late in the game wasn't actually that helpful for day-to-day decision making. And so how do we reconcile this sort of very broad time landscape in which benefits might arrive? And so this is, I suppose, just to sort of articulate that we felt that there was a bifurcation, a separation between sort of issues around what the measures were and issues around how the system used those measures for rewards, for sanctions, for decisions. And that those were sort of two categories of issues that people were trying to reconcile within designing their own measurement systems for collaborative working. Finally, and this is just sort of a maybe tacit point which underscored a lot of the work, which is that there's a question around democratic accountability in collaborations. And it's one that I don't think anyone has really resolved. One is that it's less democratic because you are ceding control from government, and there's a lack of a straightforward mechanism by which policymakers are held to account. But there's other people who argue that there's greater legitimacy, so that it not only provides more checks and balances in a centralized system, but you have more opportunities to weave in citizen voices. And so there we go. I'll read this. It's a quote from the report, but I think it's an important thing to underscore, that collaborations require a compelling and accurate narrative to communicate legitimacy externally. And most collaborations that we spoke to are accountable for, and thus base their legitimacy on, improving outcomes for service users and citizens, making a deep understanding of both client need and approaches to generate better outcomes essential precursors to improving delivery systems. In turn, this is dependent on having quality information and a willingness across partners to work to the interest of service users, even if that is not perceived to align with their own organizational interests. Now, I'm sure we're going to argue a little bit around what quality information looks like, but as with any sort of exercise, we kind of left the report and our current work with a series of questions, which I'll run through real quick, but then I think the most important thing is for conversation to take place in the room, which is around sort of, you know, what are the regulatory or statutory kinds of things which prevent collaborations from functioning? Does collaboration deliver better impact and value? How do we embed collaborative practice that's resilient and effective in navigating setbacks? These aren't easy, so you need people to commit over the long term. How can governance enable autonomy without reverting to hierarchy? What, as I mentioned, does a good system of feedback and learning look like? And what is the right way to engage citizens? And those were the sort of questions that we had moving forward in our own work. So I will leave it at that and pass it back over.
Thank you, Claire. Before we sort of move into the discussion, I'll just ask, first of all, does anybody have any burning questions or comments at this point, points of clarification perhaps about what Clare has said or what the report's about before we get into the detail of the questions? Great. Oh, yes, please. Could we just wait for a microphone, please? We just, if you don't mind, somebody got a microphone handy? Thank you. We're being recorded, so people need to speak through their microphones.
John Tambernino, White House Office of Management and Budget in the U.S. Two things for Clare. One is you talked about what does success look like, but I'm curious what failure looks like. So the 20 partnerships that in some ways didn't work, or the 10 rather. And the other is just to say that what we've discovered in the U.S. in terms of promoting those kinds of collaborations is there's no doubt many benefits, including the sort you described, but real costs. And that typically to make them work requires just some cadre of smart, engaged, dedicated, energetic staff to work across all kinds of boundaries and to work against all kinds of institutional inertia and that sort of thing. So in a couple of projects we have that are explicitly to promote that kind of partnership across federal agencies and with states and localities, is becoming increasingly apparent to us just the amount of energy needed to sustain them and the opportunity costs. It means staff are working on that as opposed to some other difficult problem or challenge. So what were your thoughts there about just how much more of an additional sort of injection of energy was needed to make these possible as opposed to just doing things as normal?
Yeah, those are both really good questions. To your first one, we obviously have a bit of a sampling bias here in the sense that we've looked at collaborations that have sort of been in operation for a while. So in terms of your question around what does failure look like, I don't know that we have instances where there was an attempt to make a collaboration and it's fallen over. I think for these particular organizations, what we saw perhaps was that kind of commitment in the long term to, as things were going off the rails, to continue to figure out a way to work together. But it's a great question in terms of what is the sustainability of a lot of these things and what does failure look like when it does cease to exist in a meaningful way. In terms of the costs of doing collaborative working, I think it is well documented that the administrative costs in particular for a lot of these things to function are large. I think what we don't have a good appreciation for is exactly what the comparison looks like. And so the calculation of costs is, I think, one of these things that's difficult to understand and compare in a meaningful way. I think the important thing to recognize perhaps is that there is value to the sort of overhead or administrative side of working, especially in sort of multi-layer or complex networked organizations. And that in thinking through whether or not you are trying to pursue these things, there is a necessity for allocating budget to that function. So it's not just around squeezing organizations to deliver programs, but it's to adequately fund them as well for the kind of oversight and administrative activities that should be happening to be able to run things well.
If I could just chip in before we move on to that. I think one of the cases that we looked at was a near failure. In fact, it just about found itself to describe itself as not a failure. And what I mean by that is that it was an agent of change type model where an organisation was engaged to work with a number of people within an organisation and effect change within that organisation, but it sat as equal partners. It both received grant money to fund that work equally as the public sector, so the voluntary sector and the public sector organisation were equal partners in that. But the reason for the near failure is just very purely agenda change, that they applied for the money at a point in time when the particular thing they were tackling was a high priority, and then there was it was an Ofsted failure, basically, which I'll explain to people in the room. Basically, the inspector who looks at children's services failed the authority, and basically the whole energy of the authority moved towards that problem and not the problem that was originally engaged in the grant work. So to the point around its costs and energy, I guess it's got to be something, there's got to be a burning bridge, there's got to be a need to do this which is sufficiently compelling, that keeps the focus and the energy from all of the parties in the room. And it's a very big choice to say we're going to work in this way, and it has to be compelling over a long period of time. Okay, any other questions before we move on? Well, if we get the mic, thanks.
Thanks. Just building on that point, so and thinking about the difference in kind of time and energy that's required to work in this way, did you get much from people that you were interviewing about the sense of the amount of time that was being spent not to good effect in systems that weren't working very well now? So, for example, people working with a vulnerable person and spending lots of time advocating for them with other services that they felt they weren't getting access to, dealing with disputes or disagreements between public services, that, you know, the sorts of things where, you know, lots of people spend lots of time doing and it feels like you're banging your head off a brick wall. Did that come up very much as a kind of reason for trying to move to point B?
Yes, in short, it really did. You know, it was about being able to join people up, both organisationally and operationally, so you aren't banging your head against a brick wall. That was part of the compelling reason to do this. But then how you get to that point where you can unpick some of that custom and practice and move towards the new world. There's a transitional, I guess, inefficiency. There's a point at which you've got to keep, you know, you've got to change the system, and that's tough. It certainly is costly and tough, but you have to then hope you get the rewards of efficiency about getting rid of some of those problems. Okay, shall we move on then to our panel discussion? What we were going to do is pick out some particular points. That's not to sort of narrow down the debate that people want to have around other things that come out. So they're fairly they're wide topics. That means that we can go in different directions with them. We're going to start off with the first part of the presentation and the report is trying to understand a little bit more about why people choose this route of collaboration. What are the drivers? And you know, we've heard in the report that what we found is that the changes were fiscal in many cases. In some cases, there was a change of political philosophy, perhaps, and or leadership style. So, but does that mean that it will only happen in some places where those conditions or those appetites are, or those conditions exist, or should we expect to see it more mainstream? Robert, could I ask you perhaps just to take that question as a first go at it?
Yeah, no, thank you very much. And thanks very much to the GoLab team for organising today's events and for really engaging conversation and for people who've come a really long way. I'm going to start, I think, by introducing a bit of maybe historical perspective on this. But I would agree with a lot of the drivers that you identified around the austerity, the burning platform, the rise in demand, changing citizen expectations about what they should expect from their local services, and the role of new technologies, digital and data. And those were all things which I think I was part of a programme in government from 2012 to 16, which was trying to really get to the bottom of this question around collaboration. And I suppose they were probably the early adopters. And it's great to see that you found people still continuing to do this, because I think the agenda has dropped off, certainly the interest of ministers since 2016. And you have a really powerful quotation in your report, which says, collaboration requires power to be relinquished and redistributed amongst partnership members. This brings risks, but where there's risks, there can be rewards. And I think that was the fundamental thing that the coalition government was trying to test through a place-based system-style approach to reforming public services. And there's been lots of talk over the last couple of days about projects and systems. And so I think I'm split in two camps, and I think they can both exist in the same space. So we found that when you try to join up systems locally, it's really important to have common sense of purpose and vision around a set of priorities. So a number of places that we collaborated, and that was civil servants and local public sector workers from lots of different agencies. Often there wasn't a common strategy. If you don't have a common strategy or direction of travel, it's really hard to collaborate. Leadership was really important. The kind of leadership that recognises that giving up some sovereignty from your own organisational resources can achieve a wider benefit. That's really hard, and that requires trust. And I think Gary's got some really good examples of how you do that, so I'm not going to talk about that in much detail. I think we developed a maturity model which was trying to understand what are the conditions we think that need to be in place to enable local public systems to work together more effectively, to engage their citizens more effectively, to try and feed back what they're learning about delivery into the way they manage services and think about the future, but also their relationship with central government. And this is where I think it's worth introducing a little bit of history. So this idea of collaboration was also quite a big idea in the mid-60s, and a Royal Commission was set up, and it operated from 1968 to 1972, and it was called the Radcliffe-Maud Commission, and it tried to rationalise the way in which the state, in a sense, provided services to its local citizens. And in the UK, I think we've got a very powerful centre and very powerful ministries, and we've got a very fragmented local authority landscape. The commissioners, often the commissioners who are trying to pull off SIBs and other complex forms of commissioning. We've got over 350 just in England, and there was a recognition back in the 60s that this probably needed to change, and one of the drivers there was to reduce the number of areas to around 61, but importantly, people services, by that I mean health, social services, housing and education, would all fall under one authority. That didn't work, although it had some support in 72 after both the Labour and Conservative parties hinting that they would implement these measures. It didn't go forward. And there's been some boundary changes and reforms since then. There was another attempt, I think, by the Blair administration. They introduced regional development agencies. But this is a top-down process, and I think it's hard to do collaboration from the top down. Then this idea of regional assemblies, and they failed in the northeast. Interestingly, Dominic Cummings was involved in that. He campaigned against the regional assembly in the northeast of England. But the idea there was really to connect people more closely with the resources and services in their areas. So this idea of collaboration and systems, I think, has been around for a long time. And maybe what we're seeing now, and your report really highlights, is that people are just trying to get on and do it themselves. But they're trying to do it within a system that has a history and is quite complex, where you have lots of very weak actors with not a lot of, I think, central license to operate. And it means that places like, I think, Plymouth are deciding, well, without greater support from the centre, we're going to go and try and do this collaboration ourselves. And I think with a bit more enabling from the centre, with a little bit more resource, with a little bit more of the types of things that previous initiatives have thrown up that work, you could get far better collaboration, better trust, and more likelihood to, I think, provide better public value and better engagement with local citizens. It's very hard to quantify and measure that. But I think I was quite proud, and my team was quite proud, that we were able to gather quantitative and qualitative evidence and influence national policy in the way that funding flowed. It's a shame that hasn't been continued, because I think to some extent collaboration is trying to fix an issue about the way the state is organised, and that's to the credit, I think, of all the organisations that you've found and spoken to.
Very interesting, thank you. Gary, you've been semi-invited to chip in, I think, on this. Do you want to...
done this stuff.
I think I'd start by answering the question about what would failure look like, and it would look like now. It would look like the status quo. So I think the genesis of pretty much everything that's happened in Plymouth, and there are a number of other places around the country doing similar things, is the recognition that the place we have got to with the purchaser provider, marketisation of services, that is the problem. That sets all the problems that flow for particular groups. And those particular groups are the most marginal people, the poorest, the sickest, the people with multiple morbidities, who don't fit models of standardisation, they don't fit algorithms, they're not neat, they cross boundaries. and they use, the reason the state's particularly interested in this, they use lots of unplanned care, which is very expensive. So a failure for us would have been to achieve no change at all, to be left where we were. So Rob's right, the kind of genesis of the Plymouth thing was this recognition that Plymouth's a really poor coastal city. It's post-industrial, post-military city with a very low average income, and funding formulas are quite important in local authorities. Historically, Plymouth's per capita funding for things like health and social care has been grossly underfunded, and successive governments for a number of years have promised additional funding, and that's never come. And then the local politicians basically, I think, took the view that it's pointless waiting for the cavalry because they ain't coming. We're going to have to do something ourselves. And well, they set off on this journey about becoming a cooperative council. And I think they had some ideas about what they meant, but what that meant, becoming a cooperative council, but they didn't have a really kind of developed idea of what that meant for services delivery in our place. And luckily, we did, if you like, a small group of officers. We had some ideas, the genesis of which was in a failed lottery bid in 2012. And essentially, the key thing was exposing multiple actors across the city, decision makers, politicians, chief executives, people with lived experience, their carers, their friends, staff, about 800 of them. A small core group spoke to about 800 of these people, and they were unequivocal in telling us what was wrong with the system, that you know, we were trapped in this top-down, opaque, disempowering, master-servant commissioning relationship, which commissioned for short time frames, narrow horizons. It fragmented the system, and it meant that our most vulnerable people could not get access to services. They were persistently handed off by services. So that was the kind of genesis of the Complex Needs Project. The Complex Needs Project is about services to people with mental health, drugs, alcohol, offending, and homelessness. Anyone who's worked in the field can picture the kind of people we're speaking about. So that was really the driver for us. And that project started in 2012. We awarded contracts this year. Having said so, there was a bit of a hiatus to do with some reorganisations in local government, particularly reorganisation of the NHS, which kind of delayed the start. So it hasn't taken 7 years of continuous work. It's taken 4 years of continuous work to get to our contract phase. But actually, this was the scheme where we did lots of kind of learning from our failures. There are a number of other collaborative projects in the city which are kind of not making those mistakes, so they're slightly faster. And there are also in the council kind of taking on this. It's kind of given permission to non-government organisations to also take a similar view. So Matt Bell, who's a Go-Lev fellow, he's doing some very collaborative work as a voluntary sector umbrella organisation, so as an NGO. But the first big collaboration was public health, the clinical commissioning group, and the council legally pooling all their money and integrating all of us commissioning staff. So that immediately removed the historical turf wars about why would I put in an intervention in social care that saves you money in health. In the old system, that makes no sense. Your costs in A&E are not my costs. Of course, now we're integrated. If I save money in A&E, I can spend it on accommodation for homeless people or medication for drug users. So that was the first big kind of crucial integration for us. And it meant you were sitting alongside the other commissioners. So the Complex Needs Project is 29 services and 5 commissioners, all working kind of collaboratively. And that is kind of distilled into an alliance contract, which is a contract which incentivises cooperation. There are 9 services and 3 commissioners that constitute that. So I think I'll leave it there.
Yes, we might pick up a bit more detail. moving us on a little to the question that we've started to discuss is really around the role of citizens as partners, and where do citizens, how far do citizens become part of the system? And I think, Adam, we're going to talk a little about the community paradigm on this, and your new chair in particular in Wigan, setting a sort of new, what I think they called a psychological contract in Wigan that talked to citizens about my role, your role in making change or making improvement happen. So could you tell us a little bit about your work and where you're thinking the role of citizens will go?
So the work that we've done around the community paradigm deliberately has a very simple message at the heart of it, which is the key to transforming public services and making them fit for the big challenge that we think public services now face, which is rising demand, is to hand power and resource over to citizens, to communities, basically. And the reason we've got such a simple message is because we think it's right, but also because we think it's simple messages that shift whole systems. One of the problems that I think public sector, public services have is that we tend to think about change in terms of innovation transfer, or we tend to think about change in terms of long lists of rules which we need to apply. These things are really difficult to actually shift the whole system. You look back at the history of when the public sector has gone through real shifts in the way services are delivered, it's normally around a pretty simple message. So if you look back to the 1980s, it was public services need to behave more like a business or more like a market. Now, that's not to deny there's an enormous amount of complexity underneath that simple message, but it's that simple principle that will shift practices. So very quickly, why do we say that? Why do we think citizens are so fundamental in citizen engagement and involvement in designing and delivering services is so fundamental? I'll just highlight 4 very quick reasons. One is this issue of the need to shift to a preventative model. If we're going to deal with the real challenge that rising demand is, then we need obviously to move to a preventative system rather than a system built around acute response. The way we currently do that, or the way central government in particular does it, is by exhorting people. You tell people what to do: eat less junk food, get more sleep, cycle more, those sorts of things. And then if you don't do it, then we'll just make it expensive for you to do the bad things. We'll bung tax on your junk food or tax on your sugar or whatever. We think actually the best way to move to a preventative system is to empower people, to give them power and resource to take responsibility for their own health and well-being. If you're asking people to take responsibility for their own health and well-being, you need to give them the tools to do that, which means handing over power and resource. The challenge is that in the public sector, we're generally very good at hoarding power and resource. We've spent 7 decades learning how to hoard power and resource rather than hand it over to people. So that is a pretty major challenge. A second reason to really hand power over to citizens, and I should say to communities really rather than citizens, is because the experience of public services that are really doing that is the community then becomes a catalyst for radical change within the public service itself. We tend to like to think in a rather paternalistic way that the public service is the catalyst for change out there. We're the ones who can deliver better lives for people. We're the ones who can deliver social change. But what those who have moved into this approach have found is that actually, when you hand power over to communities, they start forcing integration, the sort of integration that you've been talking about, that the public sector has been trying to deliver for decades and pretty much failed. Plymouth accepted, you're doing amazing stuff there. People in the community, when they have power, they don't care who has responsibility for what. They don't care who holds what budget line or what budget. They just want things resolved. They don't care that public health belongs to local government and that A&E belongs to the NHS. So when power is genuinely handed over, the community itself can become a catalyst for that greater integration and holistic working within the public sector. The third reason I would highlight is the vital importance of creating networks. If you hand power and resource over to citizens, over to communities, you strengthen networks, you start creating new networks, you start creating social capital. And everyone knows all the literature on social capital and how important that is. But I would just point to the World Health Organization, which in its own research and exploring other research has concluded that being part of a strong social network is as good for your physical health, not just your mental health, is as good for your physical health as giving up smoking. It's that fundamental in terms of forestalling illness and longevity. So in terms of a preventative approach, actually creating those social networks is fundamental. And then my final point, which is sort of deliberately provocative and controversial really, but is actually, I think, hierarchical institutions or institutions in general are not a particularly good way of delivering change. They create automatically a division between the people who are creating change and the people who are in receipt of that change, when common sense tells me that really you want everyone working together to deliver that change. And people like Elinor Ostrom and Ivan Illich, sort of great thinkers, were talking about this 50 years ago, but it got lost in our obsession with hierarchy, and then it got lost in our obsession with markets. So I think one of the really exciting things that's happened actually in just recent months is actually the growing interest in work of people like Elinor Ostrom and the emphasis she put on the importance of self-governance as a way of solving social challenge.
Thank you. Before I hand it over, we'll draw a pause at this point and invite people in the audience to comment, ask questions, etc. One hand over there, if we can get the mic over to the gentleman in the white shirt.
Hi, thanks. Graham Dixon from Agencia. This is not a work-related point, this is a personal-related point. My eldest son is 30 and has severe Asperger's syndrome. He's just been called in to be reassessed. It all went very well, etc. But his experience is not at local level. The first people he had to contact were through the various benefits agencies, and they seem to work on a presumption of fraud and dishonesty. And if it hadn't been for me and knowing the system, he would have had no benefits and would now be homeless. How do we move the overarching system, because benefits is an important component of this, to enable people from their first contact to develop trust with the services that they're going to be dealing with in the future? Because without that, across the system, I don't just mean at local systems, it will always be impossible for people like Joe, who don't have advocates, to navigate and actually become active members of that community.
Thank you. Let's take another one at the same time. Any other hands up? James.
There was a sort of underlying assumption, I think, in what everybody was saying, that one of the biggest challenges around collaboration is separate organisations, and then you're in silos, and then you can't sort of navigate through the system. And it's quite interesting. We're also doing an evaluation of the adoption reforms that are happening in the UK. And the underlying assumption in adoption reforms is that adoption is in local authorities and it doesn't get a priority because all the other things are happening. So we're going to do the complete opposite of a lot of things that you've talked about, and we're going to spin it out of the local authority into a separate organisation. And it's early days in what we're looking at, but it does seem that what that then does is it creates, because one organisation is responsible for that, it creates a higher priority for that than it did when it's in a much bigger organisation. So is there a risk in a lot of the things that you were talking about just sort of merging things together, that actually it becomes then really difficult to prioritise all of those things? And maybe there are benefits in separate organisations being responsible and being able to prioritise different pieces.
Thank you. Great question. Do you want to have first go at that?
Yeah, I think, well, the reason why that was taken as an action by DFE, because DFE want more control over what's happening to children that are adopted, but DFE don't fund local authorities. That comes from a different budget line. So some local authorities collaborate with others and just create a wider pool of foster carers. But then there's an issue about quality, and there's an issue about markets. I disagree that markets aren't always a useful thing and a helpful thing, but there are other solutions. So yes, you've created now regional adoption agencies. The Children's Commissioner has made some comments about how successful they will be, but you're creating another layer, and sometimes that's useful, sometimes it's not. But you're not really helping greater collaboration if it's imposed from the top down. That's my only point. And that there are other solutions out there which have worked quite well. In West London, you have authorities which collaborate and create, in a sense, a bigger market in both children and potential fosterers. So there are other ways you could solve the problem. But I think, building on Adam's point, if there is a tendency to find the solution that you can control and impose a new structure, that's just another way. It may be equally as effective, but it may not necessarily enable greater cooperation. Those same children may end up neat, so how are they going to enable greater cooperation with our welfare system, with schools, with social services, and with transitions to adult social care? So it may introduce greater complexity, which may be more difficult to manage in future. We don't know.
I think the part of the point of being bespoke is being bespoke. So we don't do standardisation or routinized approaches. So we look at each issue on its merits and try to be thoughtful about that, and we try to be very inclusive about who is being thoughtful about that. And so it's entirely possible that we might see the same solution that you've seen if that's what looks the most likely to succeed. So that the whole point about this new approach, as opposed to the approach I've spent the last 20 years doing, is it's not routinized, it's not dogmatic. It's about having a thoughtful approach to a problem and opening up the space to think about that problem to lots of actors, and that on the assumption that two heads are better than one, and that you'll get a more reasonable, more sustainable solution. And if people think they've had a role in deciding that, they are much more likely to be sticky when times get tough.
Toby, do you want to come in on that?
I was thinking.
Could you just wait for a mic, sorry, because we've got, because we're being filmed.
Hi. First thing I just want to say is that generally, having been involved in a few, but nothing like in the same depth, I love collaborative models and think they're terrific. But I do think we want to avoid getting into a debate about collaboratives better than top-down, because actually collaboratives great for some purposes and top-down's really helpful for other purposes. I'm very glad actually that the school's regulatory process became tighter because schools improved because of it. I know that there's lots wrong with it, and I'm sure that we can look at a whole range of different places and say actually some models top-down are helpful. What I wanted to ask though was that in building the collaborative models, you touched on two pieces, but we didn't talk so much about the transparency of data and accountability. And I think one of my nervousnesses is that some people are believers and are willing to cede power, and they're wonderful, amazing people, but I doubt they're ever going to be the majority. And so the question then becomes, if this is going to become a norm, then one needs to be able to demonstrate its effectiveness in more traditional ways. And what are the data points that people can start to bring out, and how do we do that integration there back into the world as others who are presently holding power see it in order for them to relinquish it?
I think that's a very fair point. I think we saw sort of quite a lot of well, first I'll answer that question on a practical point around data. One of the key enablers, in fact the most important enabler of collaboration was data sharing, is that kind of transparency of data across organisations. Without it, it is simply actually one of the points of failure. It wouldn't work. People weren't sort of sharing data on any basis. So, and that was huge. There's a huge cost and energy needed to go into that, and in some cases all sorts of practical and cultural barriers to data sharing to enable that transparency. But in itself, of course, it then led to, well, what are we measuring, and how can we create that sort of common data set that we're all agreeing what success looks like, and actually how should we spend our resources and time. So it was a massive effort. Anybody else want to pick that up?
Just kind of reiterate what I said in your session, really, that I've never met a person using a service who can't tell me whether he or she is better or worse. The problem isn't in the honesty of the person. The problem is in how the decision makers accepting that person is being honest. So a lot of the measurement problem is about the people that want the measurement understanding what's valid and what's not valid. And the way we tackle that is to be really inclusive, and politicians are part of our process. We encourage them to spend time talking to people. We encourage them to spend time in services. They leave with a far greater understanding of the warts and all of what that situation's like than they ever could get from a traffic light system or a dashboard or whatever, whatever the latest word is for a red, amber, green system of assessment. So this is the point. It's about changing the entire context. It's about seeing this as a kind of big ball of problem, and you have to work right around the sphere, and that includes a discourse with decision makers saying the things you are measuring are meaningless. Come and talk to some people, and they will explain to you that they are meaningless, and they will tell you what is meaningful. And we've not yet had problems with that. Once we take people through that process, we do still collect all the red, amber, green stuff. We just don't performance manage it. So we use it as learning data. We don't beat people up if it gets better, if it gets worse, and we don't give them a pat on the head if it gets better. We just say, oh, that's interesting. What have we been doing recently that may have influenced that? And more importantly, what's happened in the external environment that may actually be driving that? So last year we had this huge spike in bed and breakfast. It's caused by universal credit. We can't change that. So under the old system, we would have been kicking someone about that, even though they have no control over it.
I don't want to lose the first question based on trust, because it's an important question. Does anybody on the panel like to pick that up? I'm looking at you, Gary, because I know you have something to say on it. Or Adam.
Yes, well, I mean, it's sort of classic institutional mindset, isn't it? Because 0.5% of the people we serve might actually be involved in fraud in some way. We're going to make life miserable for the rest of the people. I think as part of this process, and a lot of the work that people like Hilary Cottam and Julia Unwin have done recently is fundamentally part of this. It is about getting away from that incredibly hierarchical, sort of inhuman, it's not quite the right word, but you just don't relate to people as humans. You relate to them as units that you're trying to process. I've been very inspired by work that they've done in Gateshead Council, where they recently instituted a system where if people were repeatedly not paying their council tax, instead of referring them to the courts and taking court action and ultimately probably maybe having to send in the bailiffs, they approached the problem in a completely different way. They got in touch with the people who were repeatedly failing to pay council tax and said, what's causing this? What's the problem? And they uncovered a huge range of issues behind that. I mean, in some cases, people are facing very serious mental health problems. In other cases, a young woman was on the edge of prostitution. Someone else had a serious background of abuse and child abuse. And all of these things had contributed to them getting into a crisis where they were unable to have the funds to pay their council tax. In, I think it was 90%, it may even have been 100% of the cases they've dealt with so far, every person had had their benefits miscalculated as well. So it had also begun to uncover problems that were created by the system itself for those people. Now, the important point about that is twofold. One, they're not making those people's lives even worse by going down the traditional council route of legal action. But secondly, they're uncovering problems which, if they solve now, will not spiral out into problems further down the line, which are then going to end up costing public services way more than they would have saved in regaining their council tax. So it requires a fundamentally different way of looking at that relationship with human beings out there.
So you can read about that. There's the guy who leads it, this guy called Mark Adam Smith, and he blogs, and it's called Tangled and Trapped. It's really worthwhile reading the blog. So, you know, the old kind of adage that change happens at the speed of trust, and so quite a lot of the early work is about building trust, and the first phase of that for us was it's a bit like Truth and Reconciliation, where commissioners have to acknowledge how they've been doing terrible things for a number of years, and then there's a similar kind of thing where services, even services that traditionally conceptualize themselves as really user-focused, are told by the people that use that service that actually they're not at all, that they do things to them, they don't work with them, all those kind of things. So that the kind of basis of the beginning of trust is about honesty and transparency. And once you've kind of allowed everyone to vent about that and kind of talk about the drivers for that, you can then start to move on in a new way. But trust is the kind of glue for all of this, and transparency is the way you maintain it.
Thank you. So move us on a little bit. So to talk a bit about the voluntary sector, we've talked about citizens. So in a lot of the work, actually pretty much all of the cases we looked at, there was a shift in the relationship with the voluntary sector, in the sense that they were being brought in as more equal partners, that they were sitting around the top table, if you like, and taking part really as a co-commissioner as well as a service provider. Rob Macmillan, I was going to invite you perhaps to say a little bit more, you being an expert in the voluntary sector, about how you see it, how you see that sort of shift in relationship and what you see as the differences. And is the voluntary sector actually, because a lot of things, people sort of said, well, in some cases, the voluntary sector wasn't ready for that. And there was a bit of capacity building, or there was perhaps a legacy of perhaps not being treated as equal partners, that there was not an immediate ability to stand up in that way. Others were very ready to. Can you just perhaps just unpick that a bit for us?
Yes, and it gets right into the issues of trust and kind of resourcing that are kind of so important through all of these conversations. I was struck by, Clare, you said one of the reasons why collaboration might take place is one of the thoughts about the voluntary sector might take on greater service delivery roles or tackling social challenges. And the kind of position of the voluntary sector in this kind of, in these collaborations and in these fields is partly depends on what people view, what they think, what they hope they can get out of the voluntary sector, what they imagine it can contribute. And so it gets into all these kind of like hopes and dreams about what the voluntary sector can offer. And often you get into sometimes rather kind of caricatured language around flexibility, innovation, creative thinking, all of those kinds of things, reach into communities that we can't quite reach, all of that kind of stuff, which is important, but I think there's a worry about overplaying that a little bit, and so you have to be kind of careful around that. But that sense in which there are some potential more cynical reasons for getting voluntary organisations involved might provide a veneer of legitimacy. It might provide kind of lower cost solutions to things, so as there kind of cheaper options, are there possible ways there? And I think that's where some of the kind of mistrust and difficulty for voluntary organisations to engage in some of these processes comes from, that kind of baggage, that history of being treated as kind of marginal partners that can come in and do things because they're cheaper, really, and that's kind of really helpful. And what that does is it showcases the wider picture of where voluntary organisations sit in some of, certainly at local level. I mean, I think the picture is so varied at local level now that it's precisely these kinds of pieces of research that kind of pick out individual cases and look at them and in some detail, whatever selection bias there might be, you just acknowledge them, are really important just to kind of see what those processes are, because the broad story of voluntary sector involvement at local level in human services, in frontline services often, is precisely the failures that Gary has described earlier on, the kind of marketised approach where you kind of have a pre-specified tender, you open it up for competition, and and see who can kind of bid for it. And you've got price is quite a high element of the kind of evaluation criteria overstretching quality. And so the role of voluntary organisations in this case is as kind of a service provider, and that's it. Rather instrumental, you become an agent, or you become, as one of our case studies says, well, just another department of the local authority anyway, ultimately. So that's the kind of a broad picture, and that's a common complaint, such that you think, well, it probably has some kind of resonance across a lot of places, apart from the kind of beacons that we see in isolated places where people are trying to do different things, and they're trying to recognise other valued aspects or attributes of why voluntary organisations might get involved. And it includes expertise, it includes closeness to frontline issues. And I kind of sometimes like to think of voluntary organisations being kind of social discovery mechanisms, either for kind of emerging problems or the latest status of problems, or for kind of potential solutions. It's kind of like finding gaps and possibilities throughout this. So that's the kind of general picture as I see it. But there are kind of difficulties and challenges in here, which I think, you know, the research tends to uncover. One is the kind of view that ultimately, if we can get to some key voluntary organisations, that's our proxy for communities. We've done our job there. We've got communities involved because we've got to one of the main organisations in our local area, and that's obviously a full set of reasoning around that. The idea of a more equal partnership is ultimately challenging, given the kind of responsibility and kind of resource and power asymmetries that are there. So there's a question mark about how far are people prepared to go in the relinquishing of power and the sharing of power that I think you described earlier on. And then two further challenges, just very quickly. One is around, and they're related in a sense. One is that we talk about a sector, and actually, it's not a single thing. It's a very diverse, heterogeneous thing. There are lots of organisations, lots of different types of organisations, including very community-focused and sometimes social enterprise type organisations. It's a very varied picture. So getting the voluntary sector involved is a complex thing. And don't think we've got it. Don't think you can tick a box to say that you've got it. I'm not saying people are saying that, but if you've got a few organisations that are around the table, and what that kind of opens up is the idea that within the sector itself there are power and resource asymmetries. So you tend to get the more well-resourced organisations that can turn up, that have the capacity to be involved, the expertise to play that wider role. And that tends to be larger organisations, the more formal organisations. Therefore, you lose that connection to the rest of the sector. And so that opens up the second dilemma, which is around capacity and the cost of collaboration. There was a good question earlier on about, well, what are the costs of collaboration, being involved in those things? It's a problem identifying them, but it's also identifying the ability to absorb them. And actually, voluntary organisations aren't that well equipped or able to absorb the costs of collaboration, because nobody wants to pay for this stuff. So that, you know, usually organisations that are at the governance table, or they're trying to be involved in organisations, there are massive opportunity costs for the things that they could otherwise be doing or should be doing. So the resourcing of participation in these spaces is really important as well.
Thank you. Adrian.
Thank you. Thank you to the panel. I think that's been a really illuminating discussion and a refreshing discussion, to sort of put SIBS to one side for a second. My one theme that I've heard that I thought I might just draw out from what you've been discussing, which I think isn't reflected in the title, but I think is really important, is that we currently face sort of two challenges with our government and public services. One we're familiar with and talk about a lot, which is you might call effectiveness, which is we're not achieving the outcomes and everyone's disappointed, all the rest of it. But the other is a crisis of legitimacy or trust. People have lost faith or are losing faith in many institutions, but government included. They don't feel government represents them. They don't feel that they have a voice, etc. And I think that was reflected in many of the things you were saying. And I think one of the we shouldn't discount the value of that in and of itself. I think improving collaborative methods as a way for reconnecting services to the communities that they serve and rebuilding trust and legitimacy in those services arguably is more important than the effectiveness question right now. Because if you were to say, like, what's the crisis we're currently facing in government, I'd say it's actually the trust legitimacy side. So I think the title of this session perhaps should have been exploring approaches, blah, 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 to rebuild trust and legitimacy and improve service delivery, because that for me is the important point.
Please, yes.
I think that's a really, really important point. And the reason why I mentioned Dominic Cummings and the North East Assembly elections is because there is a crisis of legitimacy. There are, and I think that lack of voice that we've seen during austerity has contributed to the rise of a type of belligerent English nationalism, because there has been no voice. There has been a voice in Wales, Scotland, Northern Ireland, and with the very fragmented way we do local democracy in England, I think there are places which feel left behind, they haven't been engaged, and central government has been very distant, and so I couldn't agree more with that.
It reminds me of some of your work, Rob, around sort of the voluntary sector aren't just service providers, but they're advocacy organisations. That feels like something you might want to speak to.
Yeah, and it is the way that voluntary organisations have often been placed by governments of all shades, to a certain extent, is that actually we want you to help us provide services and provide more effective services. And if it helps in kind of legitimacy as well, then that's great. But what gets lost in this is that sense in which organisations themselves, the causes that they represent, their missions, their purposes are often much wider than just trying to sort out and fix a particular kind of problem. And so the kind of cliches that we talk about often are about speaking truth to power and being advocates for otherwise marginalised voices. Those things are really important to add into the system, because otherwise they don't get a look in, and the system can't respond to those voices unless they are there. And even if you wanted to talk about it in market terms, you could say, well, this is market intelligence. If you like, if you don't like that language, then yeah, you kind of use the idea of voice and advocacy, because I think that's a really essential part of what voluntary organisations can bring, and that's often just forgotten about and lost in these systems as well.
Big challenges, though, resources aren't allocated on the basis of voice, and the way that we organise the way resource allocation through Parliament voting on particular types of vires, i.e. what you can spend your money on, again, doesn't really chime well with that system. So although I don't think structural change is the right answer to a lot of these issues, having tried to always see the bottom up first for change, I do think that, well, we can tell we're in a moment of political crisis in this country around our constitution. But I've tried to say, if you look back at history, politicians from 50 years ago have seen these types of issues and failed to resolve them, and we seem to be in a really big mess. And I think that the messages that NLGN and Adam are proposing, again, are in a sense trying to solve some of these really big questions we may have dodged for 20 or 30 years. I don't know what you think, Adam.
It's very nice of you to say that. I think I increasingly think it's important to think about the question of legitimacy in relation to macro decisions and micro decisions. We focus very heavily on the legitimacy of macro decisions, and I agree with Robert that politicians haven't focused enough on that over the last 50 years or so, but they are starting to think about it now. There is a recognition there is a problem with the big strategic decisions that democracies take, and that's led to the rise of populism and the growing interest in things like citizens' assemblies and deliberative approaches, and those sorts of things are clearly a way of addressing that big macro decision area. But the area that we don't really talk about are the millions of micro decisions that are taken by people who are delivering services every day. And if those decisions are taken in a hierarchical sort of mindset, paternalistic mindset, how is that affecting the people those decisions are being made to, if the service is being delivered to? So I'd like to encourage more of the discussion about how we address the macro side, but we also need to talk about the micro side, and that for me is part of this agenda around collaboration and citizen empowerment, is about changing the way those millions and millions of micro decisions are taken as well.
Fantastic. I think we are now actually out of time, but I will, on that, nevertheless, be disobedient. And just any final comments from the panel, just by way of conclusion? You want a cup of tea. That's completely fair enough. Thank you to everybody for great questions.